So, the referral notes flagged issues with confusion. But is this more dementia or medication related?
It's hard to say Mihira. She's on amitriptyline for chronic pain, possibly contributing. Her daughter also mentioned episodes of agitation, especially after her iron infusion.
Hmm, that could be restlessness from low folate. And did the physio mention gait instability?
Yes, but also raised concerns about a fall risk. Her Parkinson's diagnosis complicates that, though her tremor's mild.
Right. And her vitamin B12 levels were borderline. Plus, she's had recurrent UTIs, which can exacerbate confusion too.
True. But it's the daytime wandering that worries the care home. They suspect sundowning, but it happening at noon.
Then not classic sundowning. Could be disinhibition, possibly frontal lobe signs. Let's review her meds and request a neuroconsult. Meanwhile, flag the folate levels and ask for speech to review cognition.
Agreed, Mihira. I'll note the priorities: folate, neuroreferral, and monitoring agitation. I understand that being asked to provide a urine sample can feel a bit clinical, Mihira, but it is a vital part of making sure we get you the right treatment. It is very important that we focus on not contaminating the sample during collection, as even small amounts of bacteria from the skin can lead to unreliable test results. If the sample is impure, we might fail to identify the true cause of your symptoms, which could delay your recovery or lead to an incorrect diagnosis. Once you have successfully collected the sample, the next steps are quite straightforward. Ideally, the container should be brought back to the clinic as soon as possible, or at least within 12 hours if kept cool, to ensure the bacteria remains stable for testing. Upon arrival, we will perform an initial dipstick test for immediate insights, which allows us to check for signs of infection right away. If that initial check shows anything unusual, we will then send the sample for a full laboratory analysis to identify the exact bacteria involved. This careful process ensures we prescribe the most effective medication for your specific needs.